people have been involved with the service, then we again provide and signpost links to additional support, which includes Action for ME, AIM, the local support groups. And again, it's about working in partnership, not just with the individual. It's very important that any other services that are involved, family and carers have a significant role, of course. Training, advice and consultancy. We champion the needs of people with CFS ME. It's vital that we also provide a voice for the people that we work for. And as I've said, our limitation is we are two very small teams covering a large area. So people do need to be referred into the service, they need to be registered with a GP within the region, and they need to be presenting characteristic symptoms of CFS ME. Now that may mean they have other things as well, but we need to check that those other things that they may have, the other conditions, have been screened for and are being treated if they're treatable. So that to the best of our knowledge, the symptoms that people are presenting with when we see them are indicative of them having CFS ME as a main presenting problem. So we take all ages, so for 16-year-olds and over, they need to be referred in by their GP, and for under 16, they need to be referred in by a local paediatrician. So Alison will talk a bit more about that. And we have the adult and the children's team, and they consist of occupational therapists, of which I'm one, clinical psychologists, of which Alison is one. We have a physiotherapist in the adult team who can also advise the children's team if necessary. We have a GP with a special interest, who is Jack, Dr. Chaldona over there, who's waving. And we have a tiny bit of time for a consultant paediatrician in the children's team. Now this is my bit, the adult pathway. So the thing that all the people here will recognise completely is that waiting and being perhaps misdirected at times can be a major problem when you've got CFS ME. So to get into the service can unfortunately take a long time. So some of you have been referred all around the houses to try and, you need some of that to investigate some of the symptoms that you're experiencing to check they're not indicative of something more ominous. But to actually get into the service, quite often the GPs don't send us a full set of screening blood tests, or they don't provide enough information, or we find out that another service is involved and we need to check out with them what they're doing. We don't want to keep visiting loads of different therapists or doctors and have slightly contradictory or conflicting advice. So that bit, unfortunately, can take time. The bit that I've done in green, we try as best as we can to at least have, the minute somebody is accepted into the service, they get some treatment or they get some input straight away. So the assessment, the education sessions and the individual review happen within a 12-week period when people are first accepted into the service. Now people do still have to wait for therapeutic interventions, so there is a delay for that next bit. But from feedback that we had from people, it was really important that people had something to start with. And we send out the Action for ME booklet from the minute we get that referral. We get the referral, we respond to the GP, and we send to the person who's been referred some contact details with ME support groups and the Action for ME booklets as well. Once people have engaged with therapy, we hold their case open for 6 months because, of course, ME is a fluctuating condition and sometimes people have a relapse and want to make further contact with the service. So we hold that open so if people need us again. And then, like I said before, once discharged, then we send links for people for further support. I've just put up the list of the screening blood tests. You may know those already, but it can be useful to refer back to if you want to take to your doctor, for instance. And that's just a nice picture, just to show the peaks. So these are the referrals. We've had over 3,000 referrals to the service. The proportion of women to men is 4 women to every man. And the peak age is pretty much that 36 to 45 bit. And we have, as I said, all ages. So from about age 10 up, which is interesting, Sonia, it's the same age you talked about, from about 10, and the oldest person we've had referred to is 87. So, and the therapeutic interventions we offer, because we are an NHS service, are those that are recommended in the NICE guidelines. But we do not impose any treatment strategies. We make that decision collaboratively with the individual. And these are the sorts of interventions we offer. So we have these education sessions. We do individual work or further education reviews. People need those pretty sharpish when they've been referred to us, so there's, we try not to delay on any of that. Dr. Chaldona may offer medical review if that's appropriate. We do work with pacing strategies, that's the starting place, is how to get that balance between doing and stopping. And then it may be that people choose to do graded activity management, graded exercise therapy, cognitive behavioural therapy, but we do not impose any of those. Anything we offer is through discussion with the individual. Mindfulness, we're just setting up a mindfulness group at the moment. Lots of work on sleep and rest and what rest means to each individual, and we look at relapse strategies. And we do work. Now, a lot of the services nationally aren't able to work with severely affected people. Now, one of our priorities is that we do. And this is a different pathway. So if we have somebody, we don't always know when we get a referral that it's somebody who's severely affected. The GP may not even realise it themselves. But we really need to gather information. Quite often the individual isn't able to share the information themselves, so it might be we get the information from carers, family members. We can offer some home visits. We have a limited capacity, but our priority, if we do any home visits, is for those who are severely affected. And it's very important, everyone gets an individualised plan, but particularly for people who are severely affected, because there may be all sorts of people involved. Numbers of carers, there may be a huge carer package in place, all sorts of different services may be involved, because people may have a number of different conditions. So we can offer training for carers, we can offer joint working. There might be, particularly if somebody lives, say if somebody's in New Mills, we're not going to offer a brilliant service from a distance, except if we work with the people who are working more locally. So we may offer consultation or advice to those people. And actually the person who's severely affected often cannot engage with conversations for very long with us. So therapeutically, we quite often do a bit of a mix where we do a small amount of work with the individual and a lot of work with the family and carers about supporting them to put strategies into place. And it's all about, as we've all said, collaboration and coordination. Bit of service user feedback. Like I say, we send out feedback forms after every intervention that we do. And I think it'll be the same kind of thing that Action for ME and AIM get, is about feeling heard and feeling listened to. That is a real priority, about people feeling believed at last. That's a lot of the feedback that we get. Having a clear diagnosis can be really important for people. Having this vague thing about, I've got all these symptoms, nobody will tell me what's going on, it can make a huge difference. Understanding the condition and acceptance of the limitations it imposes, that can be a real struggle for people. And not feeling on their own. I mean, people here will, part of being here is about being with people who understand and also might experience the condition. And obviously we offer specific interventions, and they really love. So when we do the education sessions, the best bit is that we have people who have CFS NE talking about their experience. I can talk till the cows come home, but really to have somebody who's gone through it themselves really makes all the difference. And the concerns, so this is the other side, the constructive criticisms really, which we welcome as well, because that's how we make changes. The things that don't work, we need to look at. So there aren't enough sessions. We do not offer as many interventions as numbers of sessions in the interventions as we ideally do. We are limited. We have a limited capacity, and Alison's giving you the wink, so that means I need to be finishing. Long waits, difficulty with access. And sometimes people just aren't in a place where they can engage with our service. They're too ill, or their circumstances make it too difficult. And sometimes it's not what somebody was looking for. Sometimes we're not what people want, and that's absolutely understandable, and hopefully the ME support group may be able to make things. So I will be stopping, but I'll just... you can read these afterwards, but the changes that we have made as a result of feedback are on these last 2 slides. Things like thinking about the environment we work in, not wearing perfume to when we work in clinics, and the things we're hoping to do in the future: more preventative work, improving access for people from black and ethnic minority communities, a wide range of education sessions, as they seem to work really well. We've got a DVD on the go, research. We've already been working with Sonia on that cognitive project, and read things. So that's me. So I'll walk away and Alison can take over. That's me.